Today, we're diving into a really interesting piece of research. It's about a new way to diagnose a common oral condition, not just by looking at it, but by using a computer to precisely analyze a digital photo. So first, let's talk about what we're dealing with here: oral leukoplakia. It's the most common condition in the mouth that has the potential to become cancerous. It just looks like a white patch, but the stakes are high. Getting an early, and more importantly, an accurate diagnosis is absolutely critical. But getting that accurate diagnosis, it's not as simple as it sounds. And that brings us to the whole reason for this research, the pretty significant limitations of the tools we have right now. To really get the picture, let's look at how things are done today. On one hand, you have the gold standard, which is a biopsy. It works, it's very accurate, but it's an invasive procedure. On the other hand, you have non-invasive optical systems. The problem? They're just not very reliable, and they often come down to a doctor's subjective guess. And just how unreliable are we talking? Well, take a look at these numbers. This chart shows their specificity. That's just their ability to correctly say, hey, this tissue is healthy. The VisiLight system is right less than 28% of the time. Think about that. That means a ton of false positives, which leads to a lot of unnecessary stress and follow-up biopsies for patients. We clearly need something better. And that something better might come from looking at the problem in a totally different way. Instead of relying on what the human eye sees, this approach uses a computer to analyze the literal texture of a digital image, quantifying patterns that we can't even perceive. The method is called texture analysis. It's basically a mathematical way to describe the patterns in a picture, based on how bright the pixels are and where they're located. It takes a subjective visual impression and turns it into a set of objective, cold, hard numbers. And this is where it all starts, with a simple, standard digital photo. On the left, you see the leukoplakia lesion. On the right, healthy tissue. Now, to you and me, we can see a difference, sure, but it's qualitative. The goal here is to find a precise mathematical signature that separates the two, every single time. Okay, now this next step is absolutely key. The system gets rid of all the color information. It converts the images to grayscale. Why? Because this forces the analysis to focus only on luminance and the spatial patterns of the pixels. It's all about the texture, not the hue. All right, so how do we actually get from that picture to data that a computer can crunch? Let's walk through the exact method they use to pull out a unique numerical fingerprint from every single image. Consistency is everything in science, so every image goes through the exact same four-step prep. A specific area is selected, filters are used to crank up and unify the contrast, and then the final image is saved in a standard format, all ready for the real analysis. And this is the tool that does all the heavy lifting. The analysis is done with a piece of software called Mazda. This is the workhorse. It looks at that prepared image and calculates hundreds of different numerical values or features that describe its unique texture. So out of those hundreds of features, it all boiled down to these three. These were the ones that proved to be the most powerful differentiators. Now look at those p-values on the right. All you need to know is that a very, very low p-value means the difference the computer found between healthy and diseased tissue is almost certainly real. It's not just a random fluke. These three features are the signal in the noise. So once you have that clear signal, you need a way to make a decision based on it. And that is where artificial intelligence comes into the picture, using something called a probabilistic neural network. You can really think of this neural network as the brain of the operation. Its job is simple. It takes those three key textural features as its input. It's been trained to recognize the patterns in those numbers, and then it makes the final call: normal tissue or leukoplakia. Of course, this is all great in theory, but the million-dollar question is, does it actually work? So now we get to the most important part, the results. How well did this thing actually perform? The first number is sensitivity, and the result was a perfect 100%. Let that sink in for a moment. What that means is the system correctly identified every single case of leukoplakia it was shown. 0 false negatives, no missed cases. That is huge. So what about the other side of the coin? Specificity. That's the ability to correctly identify healthy tissue. Here, it scored 97%. Now, remember that other system we talked about, the one at 28%? This is a massive leap forward. It means an incredibly low number of false alarms, potentially saving a lot of people from the stress and cost of an unnecessary biopsy. This 3D plot gives you a really powerful visual of why the system is so good at this.
Each dot is one of the tissue samples plotted out based on its 3 key texture features. As you can see, the normal tissue in blue and the leukoplakia in red, they form 2 completely distinct, separate clusters. It's a clean, clear mathematical separation. So the crucial takeaway is this. The analysis proved that by measuring just these 3 specific textural features from a simple photo, the AI model can properly diagnose oral leukoplakia with extremely high accuracy.
Let's wrap up by looking ahead, because this isn't just some abstract academic exercise. A tool like this, one that's objective, non-invasive, and this accurate, has some pretty serious real-world implications for the future of medicine.
And you don't have to take my word for it. The researchers themselves say that this method is a promising foundation for a remote and semi-automatic diagnosis system. Just imagine a dentist in a small town taking a photo with their phone and an AI providing an instant, highly accurate risk assessment. That could be a real game changer.
And that really leaves us with a big, provocative question to think about. Given this kind of remarkable performance, a system that can quantify what the human eye can't, are we looking at the beginning of a new standard for non-invasive screening for oral cancer?